really talking about what medical marijuana is, specifically if medical marijuana is good or bad directed towards glaucoma patients. To start off this whole presentation, we have to understand what both glaucoma and medical marijuana is. Starting off with the bigger thing, or whatever, is medical marijuana. So medical marijuana is actually is marijuana prescribed by doctors to, if they believe that it can to help relieve pain or discomfort, whatever. And then glaucoma is basically, we have these our eye sockets have a sort of pressure level that it should maintain, but what glaucoma is once your pressure levels start to increase, it gets kind of irritating, painful, and your vision itself kind of starts to become blurry. You see halos as if sun was shining down. So that's what glaucoma is. And so what my research paper is to see if using medical marijuana in the end, is it good or bad for glaucoma patients. Medical marijuana is often prescribed to help relieve some type of pain or discomfort. Sometimes, like if cancer patients are being prescribed medical marijuana, it's usually besides the pain and whatever that they get, when they usually use their appetite because of chemo, and that's something that will help them get their appetite back and allows them to eat and maintain a healthy weight. But whenever we're using it, or people are using it for glaucoma and trying to help themselves with that, what it does is once it's smoked or inhaled or whatever, it reduces IOP levels by at least 25 to 30%, and once those levels are reduced, it gives the patient a more of a it relieves the tension in their eyes, which makes the halos or like the light beaming things that they see disappear, or like they can kind of like redirect their vision and everything looks normal again. And so that's what ways that it can help, but it can also it can be a bad thing for patients, because smoking is the one way that it hits them instantly. To have those levels be low continuously all day, someone would have to continuously smoke, because if, say, they smoke a marijuana cigarette, once they smoke it, their levels will reduce, they'll be fine, feel happy, whatever, but it'll only last for about as long as that high is, and that'll be about 4 hours. But once people start to smoke more, their tolerance builds up to whatever they're smoking, the THC, and like their tolerance meaning they're getting used to it. So once they start getting used to it, they're going to have to start smoking more and more to feel the effects of the marijuana. And because of that, because the excessive smoking, it's just one of the downsides of medical marijuana, just because smoking, I mean, we all know it's bad for your lungs, it can cause cancer, it's just really bad for you overall. But if people are wanting to commit to like using medical marijuana as aid for themselves, they would have to consider having to smoke at least 8 to 10 cigarettes throughout the whole day. So the controversy that I've talked about in my research paper, and now that I'm going to be explaining, starts off with Robert Randall. Kind of in the 1970s, the mid-1970s is when, so he had glaucoma. He had been told he's going to lose his complete eyesight by the age of 25, and he had already tried different methods of taking different capsules, trying different eye drops, so many different things. Obviously, he was so young, told he's going to lose his eyesight, so he tried everything. And at one point, he like kind of gave up. He was like, all right, well, I'll just kind of do what I can and then see where I get. So he was hanging out with a friend one night, and this was 1970s Washington. They rolled a joint. They smoked it, and then that's when Robert was like, hey, like, wait a second. He's like, I can kind of see normal. His friend was like, well, what do you mean? Like, one of his best friends who knows like what has been up with his eyesight, he was like, what do you mean, like you've been dealing with this? He's like, no, like I like my eyesight, like it's fine, it's 100% fine. So they came to the conclusion that because what they had smoked, it had the effect of medically reducing his IOP levels, which had him seeing clearly in like 100%, like at 20/20 vision. And so Robert continued to use marijuana as an aid, and he like kind of made his own his own garden in the very back, like in his little porch in his apartment in Washington, D.C. Went to vacation one day, came back to authorities being like, hey, you can't have this is legal. And so obviously they asked him to turn himself in. He turned himself in, but he didn't just take the fee or take the fine or whatever. He actually was able to get friends and doctors to show like, hey, like I'm smoking this because it helps me. Like I'm not just smoking to get high. And that group effort was able to pull enough evidence to show the judge that they were using it to as medicine, and that's whenever he was set free and was given back all his stuff. And so that's kind of when 1980s hit, and that's when people started to say like, hey, like, is this stuff any useful? Like, does it actually help us medically? Can it help us? And this was kind of important to people then because, I mean, a lot of people saw it as I'd rather, if it does help me, why would I take this in medicine? Like, this is natural, yada, yada. And so one reason that people weren't able to take it is obviously because it's illegal in a lot of places. But with time passing, some states have have made it lawful or an okay thing to have marijuana, medical marijuana, right, recreationally and medically. Here in Texas, obviously, we don't have, that's obviously illegal, and so that's kind of where the controversy, or what the controversy is. It's on the state deciding, yes, we're going to allow our citizens to use it, no, we're not. And so, like, this controversy is still an ongoing thing because so much research is still being done towards it, because it can aid so many things, but it still has so many negative effects. Like, it can impair your driving and stuff. Like, that's one reason it's not here, like, not legal here in Texas. Like, there's so many, it's good, but there's so many risks that outweigh the positive. It's not an thing that we see enough good in that we need, but we have other things making up for what it does. So that's kind of what the controversy is, but. So, in conclusion, I personally feel that there are way too many things that put people in risk when it comes to using marijuana as medicine. Like, if people are going to be having to smoke as many cigarettes as they are to just feel okay with their eyes, I mean, it has a chance of possible lung cancer, which is, like, huge for me. It impairs driving, which is something that, like, you won't be able to do if you do take the drug, or it can cause a sort of addiction because people rely on it, but then their tolerance builds and just this and that. It does help many things, and it can be useful for a few things, and but I personally believe that there are other things that glaucoma patients can use, even if it's not 100% proven that it's going to help, like blanked on what it's called, but like, say you have a surgery, what's the blank of like how you're going to do? Why is it missing? I'm so sorry, but I think that doing that would just be better, just because there's so many things that people still don't know about medical marijuana, and like, just here, if we were to start using that here in Texas, I feel like it's just as a conservative state to even, one, get it into like the idea of us, we're voting for this, and then two, like, so many people would, I feel like, just be pushed away, because I feel like we have so many more medicines, and like, as we like start growing with time and technology, we're going to be able to come up with more medicines to quickly reduce and with less side effects and less negatives, to help people with many different things rather than marijuana. Thank you.